Hi there, my name is Richard Russell. I'm the Director of Medical Education at Heatherwood and Wexham Park NHS Foundation Trust. You're now going to watch a video. This video is a special one. It was made by one of our patients. Howard came to us and presented to our Board of Directors. They were very struck by what he had to say to them. I met him soon after and we got him to come and speak to all of our new inductees as they started here in the Trust. He has had a profound effect on them and also on me. I hope you enjoy what he has to say, and I'd really like you to listen hard. Thank you.
My name is Howard Kennedy. You do not know me. A few months ago, I became one of the first patients to address the Board of Directors for this hospital. We talked about the challenges they faced as leaders and what they must do to shape culture rather than merely manage and react to it. I have since been asked to make this video to spread the message wider to doctors at whatever stage of your career you might be. When I think about my own experience of doctors, I believe that as a profession your intentions are good, in fact more than good, and at its best there is no nobler profession than medicine. And I thank you all for dedicating your lives to the common good. So I would like you to take yourself back to the day you decided to become a doctor. First of all, if you feel safe enough, close your eyes. Trust me, just close your eyes and take yourself back to that day. Where were you? What year was it? What were your hopes? What were your worries? Why did you choose to become a doctor? You have a piece of card in front of you. Just write down that reason. Why did you become a doctor? This is private, just for you. Just hang on to that piece of card and we'll come back to it towards the end. My name is Howard Kennedy. You do not know me. Over the last 30 years I've worked to reform education in the UK and beyond. I've travelled around the world talking to children, social workers, teachers, ministers and governments, learning from them and sharing that learning and seeing the difference real leadership, genuine compassion and good communication make. And it makes a difference. In education it makes a difference between a child that fights and a child that thrives, a child that hides and a child that shines, a child that hates and a child that loves. And all those children become adults, and the human potential of those adults is enhanced or limited by the quality of leadership, compassion and communication that they experience. Leadership matters. Whether you are leading in the provision of care for your patients, leading a team of consultants, or leading a team of junior doctors, leadership matters. People look to you for a decision, a view, a verdict, the truth. And of course you're leaders in a profession where the decisions can be life or death. The power of life and death is literally in your hands. Steady hands, I trust. In 1962, one of the first women in the US Congress, Claire Booth Lucy, had watched John F. Kennedy's early presidency with dismay. She was nonplussed as to how this purposeful leader had become so blindsided by events, so apparently distanced from his goals. She spoke to JFK to give him some feedback and said, "A great man is one sentence." Roosevelt could be defined by the sentence, "He lifted us out of the Great Depression and helped us win a world war." She told Kennedy that he was trying to focus on so many priorities that his legacy risks becoming a jumbled paragraph. And, as a consequence, he refocused on the positive social changes he had always set out as his core purpose. And although his presidency was cut short, a sentence for his life could be that he ended the Cuban Missile Crisis, started the initiative to send a man to the moon, and founded the Peace Corps. so you get the idea. Good intentions get lost. Things happen. Life gets more complex. We lose track, focus. We're human. We're always human. What we intend to pursue as our core purpose becomes lost in our reaction to events. That is, unless we are very definite about what that one sentence is. So, let's be definite. You set out on one side of your card what's driven you to get here. Fine. Now push on through your career. What's the one sentence you want people to say about you? The one sentence you want people to remember you by? The one sentence you want people to use that sums up what you want to have achieved as a doctor? Your legacy. Think for a moment and write it down. Great leaders hold on to their core purpose and are relentless and resilient in ensuring that they are working to achieve it. In your profession, it matters a lot. Let me tell you why. My name is Howard Kennedy. You do not know me. Just over a year ago, I sat in a consulting room. Opposite me sat the consultant, who was about to tell me my test results. Strangely, I already knew what the results were going to be, and yes, he delivered the ultimate bad news message. I was as calm as could be and asked the only question, how long? 3 years came the reply, but just a nanosecond too fast. So you rise and turn and leave a different person in a different time zone. But as I did so, I was stopped by the Macmillan nurse. It went something like this. Mr. Kennedy, take no notice of him, he's dreadful at giving bad news. I have patients with the same diagnosis who are still alive 12 years on. And in that moment, you see the importance of leadership and the importance of every individual in the team. Badly led teams create the conditions of conflict, mistrust, poor relationships, heightened anxiety and confrontation. Well-led teams create quality environments, embracing the different skills of all the team members, which enhance the patient experience and consistently deliver high-quality outcomes. As a patient, you can spot the difference in an instant. My experience of your profession as I've walked through the corridors of your hospital says a lot about why the sentence you are holding matters, why purpose matters, and why teams matter, and above all, why leadership matters. So what is leadership? Firstly, a high IQ helps, but it is not enough. Effective leaders never stop learning throughout their career. They do not assume that what they knew yesterday is enough to solve the problems of tomorrow. Secondly, effective leaders are humble. They walk with care. They recognise that good relationships are the key to good communication, and that good communication is the key to getting tasks successfully achieved. They understand how their actions can have an impact on others, to inspire or to demoralise. And thirdly, effective leaders understand that seniority or title does not guarantee effective leadership. Leadership does not automatically happen when you reach a certain pay grade. You can tell people what to do, but that doesn't make you a leader. Indeed, seniority can limit the potential of others when it is used to dismiss or demean. True leaders are inclusive, transparent, and empower their staff and teams. Above all else, effective leaders have high levels of emotional intelligence and as a consequence inspire others to follow them. As a patient, over the last few years, I have had a range of experiences of doctors, some positive and some less so. One of your colleagues rang me at home. I nearly died of shock. How utterly thoughtful and life-enhancing. In a moment, a fellow human being, expert but with humble intent, wanting to see how I was feeling. I had an online consultation with my favourite world-renowned doctor, Bernie Siegel, who still today reaches international audiences, talking about patient empowerment. A man who has altered world medicine by creating exceptional patients. He challenged conventional thinking by focusing on treating the person to treat the illness. Communicating from Connecticut, he charged me $15 for half a day's work and changed my life. At one stage of my illness, I asked for a second opinion, and that upset a few apple carts, but my daughter arranged for me to have a consultation with a recognised leader in the field of cancer UK. He and his team donated 2 hours of their precious time to me, which was just wonderful, and at the close gave me his phone number and invited me to call if ever I needed further support or advice. A great illustration that at its best, the NHS can compete with anything private practice could offer. At the other end of the leadership spectrum, experiences have been more challenging. 4 cancellations of my cardioversion, 2 of which were notified on arrival at reception as I stood there with suitcase and overnight clothes in hand. A consulting appointment, a pleasant welcome, and an immediate in-depth report about me and all things cardiac. Unfortunately, we had to intervene after 5 minutes to inform the consultant that since we last met, life and health had changed, as I had been diagnosed and treated for terminal cancer. The details were there in my notes, but my consultant was so focused on the condition and not on me, the patient. Or the prostate biopsy experience. Arrive at 8:30 AM as directed. Undress, hospital gown, hard chairs, interminable wait, increasingly anxious patients who demand information and are informed that the surgeons do not arrive until 1 o'clock. So, we had arrived in good time, only for our needs, concerns and comfort to be lost in satisfying the convenience of the consultants and the hospital. I trust in that scenario, the irony and inappropriateness of asking prostate cancer sufferers to sit for 4 hours on hard chairs is not lost. And it seems bizarre that you are obliged to attend 3 compulsory sessions when diagnosed with type 2 diabetes. But on being told you have 3 years to live and your cancer is aggressive, you are politely shown the door by your consultant, with no agreement or commitment to attend anything. As a patient, when I have experienced a lack of interest or curiosity in anything other than the prevailing dogma, it is dispiriting. When I have experienced a lack of humility, insincerity or lack of compassion, it is distressing. When I have experienced a lack of teamwork, poor communication and the inability to treat me as a human being, it has been devastating. When I have experienced an outstanding leader with a team who display the highest levels of professionalism, it has been life-enhancing. To be British is to hate a fuss, but any human life is always worth making a fuss about. I believe everyone I have met in the healthcare system started out with the right intentions, and quite possibly started out with similar sentiments to the sentence for your life that you have written on your card. What takes place is that things happen, focus is lost, events take over, life gets in the way, intentions blur and are replaced by unintended outcomes. You all know the boiling frog metaphor, that a frog thrown into boiling water will jump out, but a frog cooked slowly in the water will boil to death. The culture of a challenging hospital is a perfect incubator for capable doctors to metaphorically boil to death. The recent history of the NHS is littered with examples from Alderhay to Bristol to mid-staffs. Good people, good doctors, who like you started with good intentions engulfed in the worst of scandals. Will you remain true to your purpose and be committed to building your legacy? Does it matter? Or will you become a jumbled paragraph, leaving a confused or negative sentence for your life? No one in this room has written on their cards to make people sick or to deliver poor health care. Look at your purpose. Look at your one sentence and ask yourself whether you are being true to these goals in all you do. Be relentless in seeking out and sharing knowledge. Be humble and seek to understand and build relationships of trust with those around you, checking and rechecking whether the actions you take have the impact you intended. Take a moment in every interaction to test your intentions. Review your impact and ask yourself what the person across from you might be experiencing.
So, my name is Howard Kennedy, and now you know a little bit about me. I am a human being, and I, like all the patients I represent, need your help. According to the consultant who informed me of my dying, today, as we make this video, I have 637 days left to live. I understand dying all too well, but don't tell me 3 years and expunge every vestige of hope by creating one pathway and one timed conclusion. Human beings need authentic hope. Do not promise me a miracle, I am not stupid, but as you should with all patients, do listen to me, empathise with me, and work with me as a fellow human being. Respect me and my motivation to be as well as I can be. When I talk to you about nutrition, about the well-established links between personality and health, or my exploration of cures around the world, listen and think about how partnering with your patients could possibly contribute to you becoming a better doctor. There is potential in this world for patients and doctors to work in partnership to improve the quality of both our lives. One final thought. Many years ago I came across a true story from a teacher who had tried her best but had lost control of her class of 30, 15-year-olds. So she determined one day to sort this out and walked in and got them all to do a similar exercise to the one we have just done about a sentence for life. It worked, but she thought nothing more of it until she got a letter, sadly some 5 years later, to attend a funeral of one of her pupils who had been killed in the Vietnam War. At the funeral, his parents came up to her and asked if she could accept a tiny piece of card. When their son was killed in action, they had discovered the piece of card in his innermost pocket, closest to his skin, the card he had written in that lesson. So, one simple sentence, take it with you, and in your most trying moments, occasionally take it out. Treasure it and polish it, for there in the palm of your hand, you all can be a sparkling diamond, or a team cluster of sparkling diamonds, for all those patients who, like me, so desperately need a quality experience with you and your team.